morning, my name is Sophie Cortez, practical nurse student. Today I will do my second lab skill assessment. First I will do hand hygiene and I will read doctor's orders. Okay, I have patient Parks Marta, date of birth 1956, February 20, allergy to sulfa drugs, female, primary diagnosis right hip arthroplastic. Today doctor order is to administer heparin 5000 units subcutaneous BID until ambulatory. So now we'll check the marks. So I have here the mark. I will do my first check. Patient Parks Marta, female, hospital ID 121-2392, hospital ID 121-2392, date of birth 1956, February 20, date of birth 1956, February 20. We have today's date, December 1st, 2020. It is 10 o'clock and we have to administer heparin 5000 units subcutaneous BID until full ambulatory. Hasn't been given yet, so that's the one that I'm going to administer today. In doctor's order says heparin 5000 units subcutaneous BID until ambulatory. I did my first check. My marks match doctor's orders. Doctor ordered heparin since our patient had surgery. She's not ambulatory at this moment, so doctor want to prevent some blood clots. That's why heparin. That's the reason why we are administering heparin. Okay, now that I have my first check done, I'm gonna do med math. So I'm gonna see how much is 5000 units. I'm gonna grab my supplies here. I have the vial. This is a practical vial. So doctor ordered 5000 units subcutaneous. I have in the vial 10,000 units heparin sodium. So we'll do med math first. So we need 0.5 ml. I'm gonna put it close by so I can see. So now that I have my med math done, I will do my second check. In my vial, this is a practical vial, don't have any information about my patient. So this is for Parks Marta, female, hospital ID 121-2392, date of birth 1956, February 20, today's date December 1st, 2020. It is 10 o'clock and we have to administer heparin 5000 units subcutaneous BID. I have in my vial heparin sodium. It is a multi-dose vial. It's 10,000 units per 1 ml. This is for subcutaneous and IV use, and the expire date is April 2025. So, and we did the math already, so we know that we have to withdraw 0.5 from this vial. Now that I have done my second check, I'm gonna get ready to withdraw the medication. So I have a blunt fill needle I'm gonna use. I also have I choose a 25 gauge per 5/8 inches. This is for subcutaneous injection. And I also have my syringe, 1 ml, expired day April 2024. Some of my supplies have been open already since I've been practicing. Now I will double check the heparin with my monograph, like the dose and the route. I print the monograph here. It says for heparin, it's subcutaneous injection or IV. For adults, with 5,000 units every 8 hours. The needle for subcutaneous injection is 25 gauge. That's what I have here with me. It also gives you more information about contraindications and potential hazards with this medication. I will explain my client before I administer it about heparin. So we clean the vial first. We'll clean the vial for 30 seconds. And I'm gonna let it dry. Now I'm gonna open my syringe. This. And I'm gonna open. Put this in the garbage. And I'm gonna withdraw 0.5 of air. And I'm gonna inject 0.5 of air first. I'm gonna do one hand scoop technique. So we'll put this close by. Now I'm gonna withdraw 0.5. Try to avoid bubbles. Okay, I have 0.5 without bubbles here. I'm gonna do one hand scoop technique. I don't see any bubbles here. And I'm gonna withdraw a little bit to prime my needle, my other needle. Okay. Yeah. Okay, I will change needles here first. I'm gonna discard this in the sharps container. .5 without bubbles. Now that I have my syringe ready, I'm gonna do a label. In my label, I will gonna patient's name, Parks Marta, I also gonna include a hospital ID number 121 2392. Today's day is December 1st, 2020. It is 10 o'clock. This is heparin, sodium, doctor order 5,000 units. And we draw 0.5 ml. This is a subcutaneous route. And I'm going to put my initials. Okay, I have patient's name, hospital ID, date and time, heparin's 5,000 units, 0.5, and subcutaneous route, and my initials. So I'm gonna attach I'm gonna put it on here. Now I'm gonna do my third check with my label and the vial and the marks. So we have Parks Marta, I have Parks Marta, female, hospital ID 121-2392. I put 121-2392, date of birth 1956, February 20. Today's date is December 1st, 2020. Today's date December 1st, 2020. It is 10 o'clock, 10 o'clock. This is heparin 5,000 units. Subcutaneous route, I have here heparin 10,000 units, and we did the med-math and we withdraw 0.5 ml. Subcutaneous route and my initials. So my label match my marks and my vial for the drug. So I got the right drug. So I'm gonna leave the vial, and I'm only going to bring my syringe and my marks to the patient's room. Okay, I will remove this. I'm going to the patient's room. I'm gonna bring my hand container, my hand sanitizer. I also have a picture. Okay, so I'm coming to the room. Hello, my name is Sophie. I'm your practical nurse student. Can I come in? She says yes. So I'm coming. I'm gonna do hand hygiene first. How are you doing today? She said she's doing okay. So I'm gonna close the curtain to give you some privacy, and I'm gonna let her know that the doctor ordered there's some medications for today, but first I will double check my patient's identity first. So I'm gonna ask her, could you please tell me your first and last name? And she says Parks Marta. I have Parks Marta, Parks Marta. Could you please tell me your date of birth? She says February 20, 1956. I have February 20, 1956 in the marks. I also have hospital ID 121-2392, 121-2392. I have here in the right one 121-2392. I got the right patient. So I'm gonna ask her, doctor ordered some heparin for today. Do you have heparin before? And she says yes. Which side do you usually have the heparin? And she says on the abdomen area. So I'm gonna assess the skin if it's okay, and she said yeah. So I'm gonna grab some clean gloves. Okay, so I'm gonna administer the heparin in the abdomen area for my client today. So I'll draw this. So I have a measuring tape here. So it's like 5 inches from the umbilical cord. So about here where I have my finger, I'm gonna administer the heparin on the left side of my patient. So I'm gonna make sure she accommodates in the flat in the bed. So I'm gonna make sure the bed is on the working level position for me. So I will assess my patient for level conscious, any allergies. We already know in the doctor's orders she has allergy to sulfa drugs. I will also gonna check the site. I'm gonna look for any lumps, redness, edemas, or hematomas. If we have the lab values available, we will review these lab values before we administer the heparin. So she don't have any redness or edemas, so she's good. So first I will gonna clean the site. I'm gonna start in the middle, from the center towards the outside. I will clean the side for 30 seconds. And I will let it air dry. Okay, so I'm gonna ask my patient, are you feeling okay? And she said yes, this is gonna feel a little burn, but you will be okay. And she says yeah, she knows. And the reason that the doctor ordered heparin is because you have surgery, so you are not ambulatory, so we want to prevent any blood clots. Okay, she understands. I have the gas ready here, so I'm gonna pre-open. I have this one ready here, and I have, okay, I'm gonna pinch 1 inch. Okay, I will pinch 1 inch, and then I will go in a 90-degree angle for subcutaneous, or 45. In this case I will go for 90 degrees. Okay, are you ready? And she says yes. Okay, I'm gonna put this one here. Okay, I'm gonna pinch and I'm gonna count 1, 2, 3, and then I'm gonna measure. Okay, 1, 2, 3, bear with me. I'm gonna go slow. Okay, and I have the cast here. I'm not gonna recap, I'm gonna dispose. I'm not gonna massage, I'm just gonna put a little bit of pressure, not too hard. We don't wanna do any harm in your skin. Gonna leave it there for a minute. Okay. I'm gonna make sure there's no blood coming in, nothing. You're good. I'm gonna put this in the garbage. I'm gonna remove my gloves, and I'm gonna do some hygiene. Okay, how are you feeling? She said she's feeling okay. Okay, I'm gonna make sure you have the bed cold before I go, and I'm gonna make sure the bed is in the lower position. Okay, now that I administered, I will sign at 10 o'clock today's day. Patients, Parks Marta, female, hospital D, 121-2392, date of birth 1956, February 20. I'm gonna double check here. Yeah, I got the right patient. It is 10 o'clock and we have heparin administered 5,000 units. I will sign in. For the purpose of the video, I didn't have a black pen with me at this moment. I will use a black pen. I'm sorry, I don't have one close by. These are my initials. I will use black pen for the marks. I'm sorry. Okay, so I give the call bell. I just wanted to let you know that a heparin increases the risk of bleeding. So it is very important that you use a soft brush when you are brushing your teeth. We want to prevent any kind of bleeding on your gums, and if you have to let us know if you see any blood in your stool or your urine. And if you are gonna use a razor, it's recommended that you use an electro razor. These are my teaching for my patient about heparin. Do you have any questions or any concerns? She says no, she's okay. I will come back like in 30 minutes to evaluate if you are doing okay and if you have any bleeding or hematoma in the site where we administer the injections. Okay? And she says, yeah, that's fine. So I'll give you the call bell. The bed is in the lower position. Breaks are done. I'm gonna leave the room. I will clean all my supplies that I bring with me and have a nice day. Okay? Thank you. Bye.